I want to talk a bit about the method that we used in order to run these workshops.
Right.
We had a format which was quite unique. It was one where the osteopath was asked in advance to bring a difficult case. However, they were also told not to prepare it, just to have it in mind, in order that they would bring warts and all, so to speak, all the slips, so it wouldn't be overly produced. And then they would relay that to the osteopaths, to the group. The group would listen uninterrupted. After the osteopath had described the case, the group of osteopaths would have a chance to ask questions. After which, the group would sit together and they would try and tease out the case to understand it better. Now, this is a model which I think is true of the Tavistock. Could you tell us a bit about it? Why it's used? What are the advantages of it?
Yeah. Well, there's several names to describe this kind of process. One is called, it's a reflective group. In other words, the group reflects together on the presentation. Another name for it might be a more sophisticated name called system psychodynamics. In other words, the workshop will concentrate on a number of levels in the relationship between patient and osteopath. Number one would be the you might call it the system. Who makes the referral? What's the nature of the person who makes the referral, and the patient and the osteopath? Okay, that's part of the system which needs to be attended to as well. The dynamics part of it is the interaction, say within the session. Who's doing what to whom is a useful way of understanding the dynamics. So it might be a throwaway line, or it might be some cynical comment, something that expresses a disbelief that this is going to be helpful to me. All of these point to the dynamic, and so you link both. And in the workshop, yes, we ask for cases that are unprepared. The rationale for that is that the presenter will search their memory for the memorable bits of the presentation, and sometimes what is said is often as important as what is not said, and the group will have an opportunity to pick up those unsaid things, maybe to weave an explanation to deepen the understanding. But essentially, it's not about an expert teaching a method to the audience. It's about the audience taking full responsibility for the all the elements in the workshop: the presentation, the thoughtfulness, the reflection, the feedback. All of those, of course, the facilitator or the organizer of the event also has a role, mostly around protecting the boundary of the workshop, so that people feel secure and safe in it to express themselves. Now, the question I suppose I could ask you is, how did you find it?
Well, I find it the method in general a fascinating method and exercise because of the unexpected knowledge that comes out of this way of doing things. So much can be learnt from the way that the osteopath describes the case. So much can be learned from the way the rest of the group reflect on the way the osteopath has described the case. the parts that the group misunderstand. Why have they misunderstood them? Why has the osteopath described the case in such a way that has led the group to be misunderstood? Is it because the osteopath viewed the case in a particular way to which the group doesn't seem logical or the same as theirs? And the untold parts of the presentation, the untold parts of the way the osteopath describes the case, are actually often a reflection of the untold parts that occur during the treatment session.
Precisely.
And the work that is done between the group and the practitioner, in a very unconscious way, teases that bit of the information, that bit of the puzzle, that bit of the picture out, and gives the practitioner a chance to see it and therefore understand the case better, and the group a chance to see it.
Right.
And therefore they all learn together about this.
That's very good, Danny. It's a good description. I should also remind you that in each workshop we started with a lecture, a short lecture on a theme. So, in other words, the workshop had a significant academic element to it. So that people had the references they needed to read up and so on. So it was about bringing theory and practice together in a constructive way. Yeah.